And I want to pick up on that for my final question, which is a lot of this stuff is conversation right now. So we're having these conversations, we've got this awareness that's growing, but without the funding or the political will, these healthcare systems still remain entrenched. The NHS is crumbling. Was that something that frustrated you? Because throughout the book you talk about, we need this change, but you've said to me before, you're like, I don't have the answers. Was that frustrating for you?
Yeah, I mean, it's always kind of frustrating. In my day job, there's so much more that I think I can even do to help individual patients within the NHS system, but because of, how it's commissioned or how it's structured, I am very much limited what I can do in that consultation, whether it's referring somebody to, better mental health support, so they can have this follow-on conversation, whether it's bringing somebody back to have more conversations with me, even though what we're discussing is more, a social issue and not strictly like a medical condition. I don't have that flexibility there. So I'm very limited sometimes in what I can do. That being said, I know compared to colleagues that work in other systems, for example, like in the US, or, I have family that's still, working in Nigeria, and I have friends that work in India. The health system that we have in the UK, in terms of the NHS, is one of the best health systems in the world, in terms of giving people free access at the point that they approach us, and all the systems that we have access to. And I'm really passionate about preserving that system. But it is very hard because at the moment, I see things not working. I see investment in the wrong areas. I see the erosion of services, and I'm very passionate about it. But I know at the moment, the system that we have is like failing people in huge ways, And at the end of the book, I also talk about how the way that the NHS functions is also like a huge drain on other countries' health systems, because it's reliant on a lot of support. That's my family's history. And, at the moment we train doctors, obviously there's strikes and things at the moment, we train UK doctors, and a lot of our junior doctors in the UK are going to Australia. Yeah. So then we have to plug the gap, right? And we plug the gap mostly from like former Commonwealth countries. Taking, and it's like, and then, those healthcare systems are collapsing. Ours is also, on life support, and then we're giving our doctors to Australia. We have to interrogate these processes more thoroughly. So I really am very passionate about keeping the NHS alive and having access for people, across a range of issues, but it's not really joined up as well as it needs to be at the moment. It's not doing what it needs to do.
If you became Prime Minister tomorrow, what are the 3 things you would immediately do to improve healthcare provisions, whether it's directly related to healthcare, whether it's a wider, holistic thing? 3 things. I'm just going to
Oh goodness, that is such a difficult question.
You can give me just one if you need.
No. It's a great question, to be quite honest. So ultimately, something that needs to be fixed like now, because I think, it impacts so much other things, is our mental health system, right? Particularly our child and adolescent mental health system, because the number of patients I see that have no access to like talking therapies, nothing at all, like there is nowhere for people to go. And we know mental health transcends all of health, right? It cuts across so many issues. Like, so if you have a chronic heart condition, respiratory condition, any form of cancer, people's mental health ends up in the gutter, right? And then obviously some people just have mental health issues, right, separately. But massive investment, massive transformation of our mental health system. I think it's really one of the areas that needs a complete overhaul. And I honestly think it will have knock-on effects in so many other areas because of how it relates to the whole of healthcare. So what that looks like, and I also think radically thinking how we provide mental health care, So in the mental health system, there's like crisis teams and there's things like that. I work in, community gynae and sexual health, but like even us just having access to someone in clinic, like our healthcare advisor team, that's been eroded, but people being able to talk to someone when they need to, like now, that could have a profound effect on me having more time, nurses having more time. So I think that is something that I think is just so imperative, and I would absolutely love to see. There's so much around kind of like social prescribing at the moment, which is where you can prescribe kind of like gym membership or like prescribe art classes or that kind of thing. Stuff that is not necessarily medical in terms of drugs, pharmaceutical rather, but it's like more of a social and full prescribing. And I think that is really interesting. I think social prescribing is really interesting. Sometimes this whole other conversation, I question how we use doctors to solve social issues and the constant kind of deferring to doctors to cure some of society's wider problems, and whether actually this should be
be funded by the state.
Yeah, this should be the domain maybe sometimes of other people. However, I do think that there's something in making our health clinics more holistic, right? So I like the idea of, my dad's a GP now, and I talk about his journey through surgery in the book, but the ability in a GP surgery to, have so many other people there, right? Like we need lawyers, we need housing officers, we need mental health input. Like I would like that to happen today. I would like people to have more free reign over who they're employing in their practice and for what purpose.
A social centre.
A social centre of health, a fully holistic health model is what we need, right? And I want people to have the freedom to design those healthcare systems, right? Without the restrictions of, the commissioning that we have. Because I can see it every day, right? That what I need now, as I've mentioned, is I need, somebody that does psychological input. I need them there. We need them consistently, and how that would work in the long term, how that would improve our service. But the loopholes and all the things that you have to go through to create those holistic services, it's just impossible, right? So people go off and they do it in the private sector and they charge astronomical amounts. It's not accessible to the people actually that would benefit the most. So that is another thing. What would
I think you've done many things. You don't need to. Okay,
good. I'm glad.
That was fantastic. I want to live in the country that you oversee now. I'm getting quite sad that we don't have these social centres, these one-stop shops where you could go for all that incredible advice. Maybe one day.
I think
this could be the start.
I mean, I always say, when people are like, oh, well, what do we do about all of these things? And I'm a massive fan of like collective action. I use those examples in the book of how, rights and things have been hard fought for through collective action. But ultimately, I think you just have to dream of like your health utopia. I think that's really, really important. Okay, that we all envisage like the best, dreamiest set of circumstances. And for me, I have to keep thinking of that. And, that might never be obtainable in my lifetime, but I have to believe it's possible. Like, I have to believe that's possible.